Hi, my name is Labib Shahid. I'm a graduate research assistant at the Department of Mechanical Engineering, University of Wisconsin-Madison. My presentation is on computationally enhanced 4D flow MRI for the assessment of pre- and post-coarctation repair aorta flow dynamics. Let's start off with the purpose of this study. We're interested in coarctation of the aorta, which is a congenital heart disease characterized by a narrowing in the proximal descending aorta. This results in altered blood flow in the aorta and subsequent complications. Interventional treatment of coarctation includes surgery, stent placement, and balloon angioplasty. Diagnostic imaging such as cardiovascular magnetic resonance plays a role in intervention planning and the assessment of treatment success. 4D flow MRI is a diagnostic imaging technique that is often used when treating patients with coarctation. Despite advances, current issues in 4D flow MRI include insufficient spatiotemporal resolution, its inability to detect aneurysmal flow, and distortion of signal due to metal artifacts like a stent. The methods in this study are as follows. We studied 2 pediatric patients and 1 healthy control. Patient 1 had a mycotic aneurysm that was repaired through surgery. Patient 2 had severe aortic kinking in the proximal descending aorta and was repaired by stent placement. The aorta anatomies of the subjects were segmented using their contrast-enhanced MR angiograms or CT scans. Lastly, computational fluid dynamics CFD simulations were carried out using segmented aortas. Boundary conditions were derived from their 4D flow MRI studies. During these simulations, a novel technique called adaptive mesh refinement was implemented. The figure on the right shows the different stages for the patient 2 pre-repair case. Here we present the in vivo 4D flow MRI data for patient 1. And these are the results we get from our CFD simulations. We want to compare the 2 results and analyze how close they are to each other. We can qualitatively observe that the velocity magnitudes match at various stages of the cardiac cycle. The red circle shows the location of the mycotic aneurysm. 4D flow MRI clearly fails to detect the blood flow inside the aneurysm. This is because the blood velocity in the aneurysm is much smaller than the velocity encoding, VENC. CFD is capable of quantifying the blood flow inside the aneurysm. Here we compare the in vivo 4D flow data for patient 2, and here are the CFD results. We can notice that the locations of vortical flow and acceleration match. The red box shows the 4D flow MRI. It does not detect the blood flow inside the stent. The metal artifact distorts the signal inside and distal to the stent. And finally, we compare the post-repair cases to the healthy control. We can observe that the healthy subject has more laminar, less complex hemodynamics. The novelty in our study was the implementation of adaptive mesh refinement. AMR is a computational method where the grid size is autonomously updated locally and not globally. The regions where grid require refinement is determined with the aim of minimizing the calculated discretization error. AMR leads to more efficient CFD simulations by making the simulations less computationally demanding while maintaining the accuracy in our numerical results. This animation shows AMR on the patient 1 pre-repair case. Notice how the grid refines in certain locations and remains the same in other areas. In general, the grid refines near constrictions and the arterial wall. This graph plots the number of computational grid cells in the aorta along with the blood flow over a single cardiac cycle. The number of grid cells peak at systole and is lowest during diastole. Finally, these are the main conclusions of our study. Our computationally enhanced technique using CFD was able to match in vivo data. Qualitative analysis showed that the magnitudes of velocity were within a 15% error margin. Some of the shortcomings of 4D flow MRI were addressed. Our computational methods improved the spatiotemporal resolution. Our enhanced technique also predicted the hemodynamics inside aneurysms and stents, which 4D flow MRI alone cannot image. Comparing the post-intervention cases with the healthy control showed that despite repair, there were still residual complexities in the blood flow. Future applications of our computational enhancement of 4D flow MRI are clinical. This technique can be used for patient-specific treatment planning as well as analyzing the success of intervention procedures. With that, I want to conclude my presentation. Thanks for watching.